e-commerce platform, and
there we go.
are testing. As long as you're not logged
Somebody
in,
give me your
can't
Visa
say
card.
Tro anymore. I don't know that I can make that commitment.
Let you introduce
Steve
Steve.
Coen, come on up here. Steve Coen is a great friend of Central Kansas Community Foundation and all of our affiliates. Steve is the CEO of the Kansas Health Foundation and has been just a wonderful partner, not only in our Grow 2 matching grant process, but in health in general to Kansans around the state. I don't want to give anything away, but through the birth of the cell of Wesley Hospital being divided out and their foundation being established back in 85, 86. That they have been a tremendous resource in Kansas for health-related resources and interests. So I want to let you take the stage and give us a great update, and then we're looking forward to sharing a little bit back with you about what we've done.
Great. That'll be wonderful. Thank you,
Thank
Andy.
you.
Well, good morning to all of you, and thank you for letting me come today and share a little bit about the foundation, our initiatives, and some of the future things that we're looking at here today. I really want to thank you for inviting me to come and celebrate the work of your great foundation. Really amazing what you've accomplished here. I also want to thank the Learning Center for hosting this event today, and also the Halstead Community Foundation. It's great to be able to be here and celebrate all that you're doing. This is quite an amazing facility. I was here as a child. I think soon after Velita must have come here, because if it was in 1965, I had to be one of the first kids to ever see Velita, because I was 12 years old in 1965, so I had to be one of the first kids to ever come here and see her. I remember being very amazed at that, seeing her in action when I came here as a child. So this place has changed a lot since those days, but it's great to be back. On behalf of the board and staff of the Kansas Health Foundation, we sincerely appreciate the passion for the work you do here at Central Kansas Community Foundation, and we want to thank all of you for all you do to make your communities stronger. You have been great partners to the Kansas Health Foundation through the year, and we look forward to continue to work with all of you to improve the health of our state. I thought I'd start today by just talking a little bit about the Kansas Health Foundation vision, because it really is connected to the GROW initiative. Giving resources to our world is what that acronym stands for those of you who don't know what that all means. And at Kansas Health Foundation, we developed a new vision for our organization a few years ago. And the vision for the Kansas Health Foundation is we envision a culture in which every Kansan can make healthy choices where they live, work, and play. And I would say the key word in that vision is the word every, because we want every Kansan to be able to do that. And unfortunately, we know that not every Kansan has that choice to be healthy where they live, work, and play. There's some Kansans that just don't have that choice because of many factors. And so we're focusing more attention on those Kansans that don't have that choice to live that way in Kansas in the future. And your work is helping make that vision come alive. As all of you know too well, there are many needs across all the corners of our state. To maximize the impact with limited resources, the Kansas Health Foundation invests in ideas that make us have healthier people and also stronger communities, the communities in which you all are working across the state of Kansas. And to do that, we rely on data to identify the critical health needs in our state, and we, as I mentioned, are focusing more and more attention on the vulnerable populations in our state, reaching out to low-income people, racially diverse communities in both rural and urban communities in our state. As we invest in healthier people and stronger communities, we are focusing our work on the top health threats in our state, including things like reducing tobacco use, which is a leading cause of health and disability in our state, and actually in all states in the nation. We could really stop tobacco use. It would have a huge impact on the health of populations in our state. We're making sure that people have access to healthy foods that they can afford. We're trying to get people more active so that we can turn around the obesity crisis that we have in our state, Kansas is, we're the 7th or 8th most obese state in the nation right now, which is hard to believe. And it's epidemic proportions with our children, which is very sad. We're trying to find ways that people can get more affordable health care when they need it, and we're trying to promote strong, healthy communities across the state. Many of you I know have heard the quote before that the true meaning of life is to plant trees under whose shade you do not expect to sit someday. And together I believe that all of us in this room and others are doing that by establishing and building strong community foundations in our state. By doing this together, I think we're being visionary about what will make our communities and states stronger in perpetuity. And thanks to you and other many generous Kansans, your communities will have a great deal of shade for many, many years to come, because you're truly planting a seed that will continue to allow a tree to grow larger and larger over time as more and more gifts are given to your community foundation over time, either through planned gifts or through donations. We have seen this play out all across the state of Kansas. Just by planting that seed, some big planned gift comes down in the future, and suddenly that community foundation grows and expands in some way that people had no idea would ever happen. Some little community foundation in places like Bird City, Kansas, can suddenly become so large that people are doing things that are remarkable in communities in Kansas that they never had any idea they would ever have the potential to do. When the Kansas Health Foundation's Grow Initiative first began, our goal was to build and strengthen a dozen community foundations in Kansas by creating local philanthropic leadership and resources to improve the health in Kansans for many years to come. We worked together through grants and matching dollars to increase philanthropy, improve the health of Kansas children, and develop a network of partners. Now this map that Christy's putting up here shows the community foundations that were covered through our first Grow Community Foundation initiative. And because of the wild success of that first initial Grow program that we started back in 1999, we expanded it through our Grow 2 initiative. And this map shows the areas of the states that have been impacted by both Grow 1 and 2 Community Foundations program, and how great it is to see your work spread across Kansas. Now I want to spend just a few minutes talking about their growth journey and the resources that it has developed across the state of Kansas since it first began. Now when I mentioned when the Grow 1 program first began in 1999, we started with 12 community foundations in Kansas. And those 12 community foundations had a total of about $19 million in resources when we began operating. Kansas Health Foundation and Grow 1 contributed nearly $30 million towards that initiative. This leveraged about another $28 million in additional giving across the state. Now 10 years later, in 2009, these foundations had nearly $95 million in total assets. So that showed how that initial giving expanded $100 million nearly in giving in Kansas, just through that first initiative. Now in Grow 2 in 2015, we were up to 39 foundations with a total of $575 million in community philanthropy in Kansas, a tremendous growth in assets. We hardly had a presence of community foundations in Kansas when we first started. And today, the Kansas Health Foundation has contributed nearly $20 million to the Grow 2 initiative. Now we have about another $2 million to go at the conclusion of that grant next year. So far, Grow 2 has leveraged over $42 million in additional giving in the communities participating in the program, and who knows where this is all going to end. With these 39 community foundations all across the state of Kansas, can we imagine what this is going to be someday across the state of Kansas, this network that we have established across the state? So where does Central Kansas Community Foundation fit into this journey? Well, I have to say, to the least, you have been a star participant in this program. You've done amazing work. It's really unbelievable. So far, you have raised more than $6 million through your foundation and affiliate foundations. Kansas Health Foundation has been pleased to match your efforts with $1.7 million. And we are so proud to be able to say that your combined assets are now, as Angie mentioned, $21 million in a very short period of time. Really amazing work. Quite an accomplishment when you started with what, 8.8 million or somewhere around that in assets? That's just an amazing story. And 20 affiliates? It's really quite remarkable work. And just to think, I mean, if you have this established here now and you get any big planned gifts, this will just expand remarkably, and I'm sure you will. It's just going to be a great, great resource for this part of the state. So what does this all mean for the health of Kansas? Obviously, you know many of the funds you have established already affect health, and that's the reason we started this whole initiative originally. Many community foundations, a lot of their projects affect the health of the people that they live in their communities. And all these dollars translate to good work in communities no matter what they do across Kansas. This GROW program was specifically designed to help build the capacity of community foundations, and with your local ties, you are in a great position to help with the unique health needs of Kansas and all the communities you serve. And because of your work, you've also become an important infrastructure organization for our other health initiatives beyond the GROW initiative, and will continue to be in the future as we announce other health initiatives at the Kansas Health Foundation. We anticipate partnering with you on all kinds of health initiatives as we roll them out at the foundation. Also, in preparation for my speech today, we just took a look at some of the grants that the foundation has provided to organizations in the communities that you serve beyond the GROW program. And we discovered that since 2000, we have provided grants totaling over 1.7 million. But besides the 1.7 million in matching grants that we gave you through the GROW program, we have provided an additional 2.6 million in program grants to the area served by your foundation. And some of those grants, Kansas Health Foundation helped form a Butler County Community College Task Force that played an important role in helping that college become a tobacco-free higher education institution. We provided a Healthy Living grant to the Harvey County Health Department that was able to promote access to healthier food at sporting events. We just funded a 6-week summer day camp in Elk County that taught 1st through 6th graders about the importance of physical activity and good nutrition. Those are just a few examples. Obviously, we have the 2.6 million that we funded in the communities served by your community foundation. So what are some of the foundation's current initiatives? Some of these may sound familiar to you, some of them may not. We have a program right now where we've been trying to promote physical activity in schools. It's called Active Schools, Let's Move Kansas, where we funded more than $1.7 million, helping schools try to promote physical activity in the classroom. They're educating teachers how they can have physical activity breaks in the school classroom, because we know the schools have so much emphasis on teaching to the tests. You know, they're testing all the time now to see how they're progressing. So they're eliminating PE, they're eliminating recess time. So how can we get teachers just to take short breaks during the day and get kids up and active? And they found that by getting these kids active, the kids are doing better on their curriculum that they're teaching. So we've spent some resources doing that. And also aimed at the obesity crisis, because kids aren't as active as they used to be. We have a grant of $3.25 million that will help support 10 organizations in the state that focus on health equity issues in Kansas, trying to build the capacity of those organizations to do better work in the state. We just approved a new grant with our board called the Kansas Healthy Food Initiative. We know that more than 30% of Kansas counties are classified as food deserts in Kansas. We have a lot of grocery stores that are closing in rural areas, grocery stores closing in urban areas where there's high poverty and those kind of things. And so we're trying to help either stabilize those grocery stores in rural communities that are about ready to close, or else open new grocery stores in some of these rural areas that have closed. We know that low-income individuals and 51% of our Kansas counties don't have access to healthy food. So how do we address some of those kind of areas? By providing funding, matching grants that can open some of these stores. We have an exciting new initiative called the Integrative Voter Engagement Initiative that we're taking grant applications for right now. This initiative will fund up to 10 organizations to incorporate year-round nonpartisan voter engagement into their existing health equity work. The idea is to engage communities and individual and civic activities to promote health in these communities where we have vulnerable populations, get them engaged in the civic participation process, promoting healthy initiatives in their communities. And that, as I said, is open right now for applications. As I indicated earlier, with all our grants, we're asking partners now to focus more on vulnerable populations, because we know that health outcomes are definitely affected by race, income, educational level, and by geography. And I thought I would just share a few examples based on 2 of our impact areas so you can see how we're using data to focus on our grants and our work. The first example is an area important to us called access to care. We have been very supportive of the state trying to adopt Medicaid expansion. We put a lot of resources into an organization called the Alliance for a Healthy Kansas, which has been pushing this at the state level. We almost got it done in the last legislative session. We're just a few votes short, but fortunately, I think because a lot of the work that the Alliance did this last year, we definitely moved the issue lots further this year than it had happened the year before. So we're hoping that maybe this next year we might possibly be successful. So why are we doing this? We know that more than 15% of Kansans aged 18 to 64 now do not have access to health care. But when you break down the numbers, this is where it becomes more interesting. Among Caucasians or white non-Hispanics, the rate is somewhere around 11%. But when you look at the Hispanic population, more than 46% do not have access to health care. African Americans, around 20% do not have access to health care. But then when you break it down by income and education level, those with less than a high school diploma, more than 47% of those people do not have access to health care. And those making less than $15,000 a year, it's nearly 39% that do not have access to health care. So that's when the real disparities start showing up. Income, education, Hispanics, real differences. That's who do not have access to health care in the state of Kansas. So let's look at some other issues around data. Tobacco use. We know that statewide, the general population, tobacco use is about 17.7% in Kansas, which is pretty much the average across the nation, except in states like California, which is much less, but they've been working at this issue a long time. Some other states have put a lot more in tobacco control than Kansas has, and their rates are much lower. The states that have really taken the tobacco settlement dollars and really put it into addressing tobacco use have much lower rates than Kansas does. We spend, I think, what, $500,000, a measly sum out of our tobacco settlement dollars on tobacco use. But let's look at the different populations. That's when the data is much different. When you look at white non-Hispanics or Caucasians, the rate across the board is about 18.4%. Surprisingly, Hispanics smoke much less. They smoke only at 14.4%, less than the Caucasian population, which I think people find very surprising. African Americans smoke more. They smoke 25%. But if you go those with less than a high school diploma, the rates shoot up, 29%. And those making less than $15,000 a year, the rates really go up, 31%. So all this leads to the next area that the Kansas Health Foundation is looking at very closely. If we were going to do something to address the overall health of the population, what could we do? Everybody immediately jumps to health care. But really, health care doesn't really have much to do with the health of our overall population. Probably one thing that might really address the health of the population is education. So we're taking a look at education, trying to figure out what could we do in the education arena. Because when you look at all these other factors, it's income and education that really affects your health. We probably can't do much about income, but education has a real effect on income. So we're trying to decide what we might do with education. So that's something we're really taking a look at in the future. And Kansas with less than a high school education have really bad health outcomes. Those with a college education do much, much better. So is there anything that we can do to affect those rates? In 2016, our state average for high school graduation was 86%. And while that number might sound really good, think about the 14% of students who are left behind and consider their long-term economic and health outcomes. Looking closer at the data, for the 10 school districts with the lowest graduation rates, half are found in South Central Kansas communities. The counties. Those counties are Kiowa, Harvey, Marion, Sumner, and Sedgwick. But let's even consider other factors that affect school students, like income levels. Currently, about 50% of all Kansas students are eligible for free and reduced lunch, which has jumped up pretty dramatically. The 3 school districts with the highest percentage of students who receive free and reduced lunch include Kansas City, Wyandotte County, Liberal, Seward County, and Dodge City, Ford County. And as I recall, there's somewhere around 85% free and reduced lunch. That's jumped up huge in the last 10 to 15 years. And I know Sedgwick County, Wichita Public Schools, is setting right around 80%. So a big jump. So we're really looking at that. We're looking at things like, should we be looking at reading levels at 3rd grade? Because we know if you don't reach literacy levels at 3rd grade, your chance of ever being able to read go way down. We're looking at early childhood education issues because we know early childhood could have a big impact on your future ability to graduate from high school. We're just kind of looking at the whole gamut to see if there's anything that we could do to affect education. And we're trying to be very deliberate in thinking about how we engage with all the people in that arena with the goal of helping students succeed for a stronger workforce for the future and for healthier Kansas. It is clear as you look at the data that vulnerable populations are at a greater risk, and therefore we're asking our grantees to focus also on serving those vulnerable populations to achieve health. I want to end today with a quote that I think describes how most of us still think in Kansas. We live in a world in which we need to share responsibility. It's easy to say, it's not my child, it's not my community, it's not my world, it's not my problem. Then there are those who see the need and respond. I consider those people my heroes. I consider all of you my heroes, and the people who have been generous with their gifts for future generations through your community foundations. I congratulate you, Angie, your boards, your staff, and each and every one of you for the outstanding work you have done for Kansans today and tomorrow. We are proud to be your partner in planting the seeds for the shade trees of tomorrow. Thank you. Sure.
How's Jeff Usher doing?
He's doing good.
Didn't he
He's
have
going to
an
have
accident or
surgery
something?
September 1st. So we're all praying for him to
That's
come
right.
through that well. But he's doing good right now.
Well, thank you, Steve, for kind of sharing that historic part and seeing the historic numbers of impact and the growth. I think is so astounding from row 1 coverage to today, just from the granting process and building endowment so we can help try to impact some of these social health issues. But certainly hearing some of the statistics really, again, makes you step back to say, this is why our work is so important. This is why we're here. This is why there's been an investment from the Kansas Health Foundation in the work that we do, and donors that make that connection, that are really making that connection that to be a thriving, healthy state, we really have to invest in it and invest in our kiddos. So really appreciate that message. We want to share a little bit from our Grow 2 experience. We have one remaining community that still has through December 31st to work on their match. And I would like to have Jelena come down. For the interest of time, I might ask all of you that are going to talk to come down, and I think we'll just kind of really highlight our story that you're sharing about the impact that was made with one grant. Again, it's just one isolated example. We have many, many to tell. I know I met with Jeff Usher and a couple of my board members last summer, and I think we took him about an 8-page list of all the grants that had been made through all of our Grow 2s, from very small impact grants to larger ones, and making a difference on a whole broad definition of health and healthcare related issues. So this is just a little snapshot. I might just preface so everybody kind of knows that we just kind of put when each of these participating communities got set up, what year, the amount that was awarded with the match, and then just kind of the impact, how many funds were in place at the time they got it, where they are today, for just kind of a snapshot. We'll just let you kind of read that on each slide for time issues, and then each of you just kind of share your story that you'll be telling. So Jelena, you want to come up and share a little bit about Halstead?
Thank you very much. We are still working. We're hopefully going to get a little bit closer. And we were able to help health ministries here in town. We had a health clinic here, and health ministries purchased them, and they needed help updating and getting up and running. And so we were able to grant money to health ministries in order to get the new medical building here up for them. And we just consider ourselves extremely lucky to have a hometown healthcare center where people can go to get easy healthcare when they need it.
So a great resource for local people to not have to go to Newton or Wichita or anywhere else. So a huge resource as we look at our poverty levels and look at access to care. It's a huge boom. So thank you, Jelena, for sharing that. Miss Susan Lamb, representing Heston Community Foundation.
I'll give you a little bit of time to look.
That's the teacher in her.
I will
Angie, I've got a
resist
quick question
the
about
temptation to open this curtain and talk to you about Velita because I So I have.
Susan, excuse me one second. Somebody was.
Well, the question was, did I hear you right in saying Halstead has not met their match?
They have their time frame is through the end of this year, December 31st. So as much.
So how much do they have to go to meet the goal?
Jelena?
I think it said on the slide, right?
Okay.
No,
it said 120,000.
It was around there, yeah.
Something in that neighborhood.
Okay.
Of the match, which means at least double that, and sometimes 4 times that amount because of the formula of Kansas Health Foundation. But we can do it, right, Halstead?
That fourth bullet item, explain that. It was on the other slide, and it began with 1 fund and currently 20.
At the time that they were awarded the grant from Kansas Health, they had one fund for the Halstead Community Foundation, and they've since now, in those 6 years, because they're in their 7th year, have grown to 20 funds with an asset base of almost $1 million.
Okay.
So that growth piece is what we're looking at, how that has impacted the growth. Thanks, Carol. Okay, Susan.
Okay.
Now we'll jump to you.
So I have what is probably a very personal story. In 2012, the first year that Heston Community Foundation did grant making, Chief Doug Schrader asked for $250 to create critical incident response bags. And in those were additional tourniquets, flare sticks, keys to all of our school district buildings and to the major employer buildings in our community. I was not working for the foundation at that time. I believe I was in between serving on the board, and then I became the director in 2013. I remember thinking, are you kidding? You have to have keys to get in a school building because of lockdown? What has it come to? On February 25th of 2016, that bag went into Excel Industries, and the tourniquet that was in that bag was used and saved 1 life for certain. The flare sticks went down and helped identify areas that had already been cleared out so that they could respond more efficiently. And I think that investment of $250 to save a life is amazing. And that's what the work of the Kansas Health Foundation has meant to many, many communities, and we thank you so much.
you, Susan.
Yeah, and they've grown from $100,000 to over $1 million in that time frame as well, which, you guys, these are rural communities. This is rural
I know.
Kansas. This is everyday Kansas folk. This is not the big city. This is amazing work, and then to have those kind of experiences is great. Oh, is this me? Central Kansas, Butler County. Yes, Carolyn and Jenny could not be here this morning. They funded, which I thought was really this progressive part. I think earlier we heard some words like progressive and ingenuity and all of that. This telemedicine technology was awarded to Flint Hills Services in El Dorado so that they can connect and have access to their patients at remote times to be connected. So really cool, progressive, updated stuff. So dollars going to really unique work in Butler County and specifically to the El Dorado area for Flint Hills Services in that example. And again, Butler County had a unique experience with being just kind of the main Butler County group when we started Grow 2, but we have since recognized with the uniqueness in the large geographic area of Butler County that setting up more localized town affiliates has been a better model. So this just kind of broke out how Butler County as a whole got broke down to these individual communities, and we allocated out to those communities the same matching award, just from the large bundle down to the local. So just kind of some neat stuff to see that progression and growth. Hillsborough. It's my turn. All right, Cynthia Fleming.
Yeah, we really want to thank the Kansas Health Foundation. Without their help, we wouldn't be where we're at today as a foundation. We found out that often, as was mentioned by Steve, that the children just do not get enough exercise. Our playground at the elementary school was in very poor condition. They went out and played on it, but it was somewhat dangerous because we didn't have the proper equipment. So through that,
You getcha.
we were able to help the school get started. It was actually a group of parents that went together to start this initiative, and they came to the foundation to ask for funding. And we were willing to help them with a grant that was partially out of the Health Foundation funds, and it really got that project off the ground. Had we not had the ability to use those funds, that project may not have ever totally got funded. But because we said we're gonna step up, we're gonna give a big gift, it grew, and we were able to help them through this parent-led organization to put in the new ground cover that was necessary, the rubber coating, to help buy the equipment, and to really get the project off the ground. We were also able to help Trinity Church. They have a Food for Kids program every summer where they provide school children food. We've helped them a couple of times just with the food itself, you know, giving donations so they can buy the food. But this particular time we helped them also to be able to purchase playground equipment so that they would be able to have a nice playground, so when those children came to eat, they also could play and get some good exercise with that. So again, we really want to thank the foundation, the Health Foundation, for giving us the funds that makes us have the ability to grant to give back to the community and help our children.
And I want to announce this, I think it's just an amazing landmark time. Hillsborough is over $2 million in assets under management. So amazing achievement that they've made in their community. So great job.
Thank you to our community.
Yes, that's right. For Central Kansas Community Foundation, so kind of the Newton base here, we were awarded, we kind of had a split there with Peabody, so Becky's going to come up after me, but we kind of did a share of the $600,000 initial award. And one of the unique grants that we gave from the Newton office was Kansas Cast for Kids event. This was a group of folks that really love fishing and being out on boats and wanted to give kids that maybe never had the opportunity due to their family circumstances or situations to have that kind of experience. So we hear about this in different ways, you know, and with our BIGS programs and other things, but this was kind of unique in bringing kids that were identified to have this kind of recreational experience to be with these, a lot of them law enforcement guys that happen to be involved in this, so kind of a win-win on all sides with kind of getting to know that, hey, our leaders in our communities and our public safety officers are really good people and are safe, not to be running from them, let's be friends with them, but also the experience of fishing and having that recreational opportunity. So it's kind of a neat project too that was awarded. And I'll let Becky share about Peabody.
Are you ready? You want me to go?
No, just to share, highlight that we began with 10 funds at the time of the match and currently have 19 and started with 187, 486,000 and currently have 839, 815. So I'd like to share about a grant made earlier this year to the Peabody Senior Citizen Center, and I just want to highlight that that institution is misnamed. We have a youth center that people call the hub. It's the hub of our community is the senior center. Whenever I go in there, it's just wonderful. So I walked in last May when they had just installed an automatic door, and I walked in and happened to be able to speak with Sally, who had said initially, we need an automatic door on this place. So I thought I'd bring you Sally.
My name is Sally Watts, and I'm the one that suggested that we get an automatic door.
And Sally walks in and out of that door every day the center's open.
You'll be played again.
I've seen it like 18 times and I can't get enough of her. She's adorable.
My name is Sally Watts, and I'm the one that suggested that we get an automatic door.
But an amazing example too of just sometimes these little solutions are really impactful and really important to the day-to-day function of our community. This is just kind of an overall slide. Again, back in like 2010, we started with 8.8 million in assets overall, and now and this is just with the 6 participating GROW communities, and now those communities are at the 18.9%, and then of course we've grown greater than that with the 21 million in assets. But annually, the impact so far in 2017 is 144,000. We still have some of our health grants that have not been given for 2017, so that number will even be higher. And just to realize that's an annual. This is about building endowment, the permanency that will be here year after year for our generation and for the next generation. And that's the real important message of realizing the constraints that were given with the grant are an important process to saying we could have quickly expended all these funds to take care of a need, but being able to do it in a timely manner and know it's here forever is a really powerful message, and it will just continue to grow and grow. So again, we thank you for your investment.
Thank you.
And anytime you want to hear stories, I was telling Christy too, we're happy to share our stories. I know any of them would love to have you come out and meet any of their programs and services. So I appreciate you both being here and participating and letting us indulge to share back a little bit about our experiences.
Okay. Well, hey, we're back on schedule. Like it. That means lunch is going to be on time. Which is even more important than anything else, right? Because it's looking really good. I know Bill's in charge, so we know we'll have a good meal. I think we owe Steve a big hand of his leadership at the Kansas Health Foundation has definitely had a major impact and has changed the lives of all of our communities and many of our friends and families and neighbors. And Steve, I hope you're not retiring soon, because we need to keep that going and keep going what you're doing. I love to watch and see all the activity going on out of you guys. And give yourselves a big hand of congratulations too, because Steve's given you guys the motivation and the inspiration and the reason to go out and do, but it's you guys that are making it happen. And I think you need to acknowledge and recognize that, we understand why you're tired and why you're multitasking and why you're doing all the things and why you're so busy. because it's you guys going out and really doing the boots on the ground and making things happen, and you can see the impact. I know you all have lots of stories to tell about the good things going on, and I know there's a lot more potential and opportunity out there, and I know you guys will keep going and working with us. We do want to now, what we're gonna do now is break for lunch. The Learning Center here has agreed to give some short tours, so if you want to see a little bit more and hear just a little bit more about it, if you're really hungry and you want to go right to the lunch line, you can go right to the lunch line. That's okay too. We're going to have a little bit of networking at lunch, so you can sit, as I mentioned earlier, I do not want you to sit by anybody you know. I want you to sit by people you don't know, or people you want to learn more about what's going on in their community foundation. I want that social interaction going. Then after lunch, we're going to stay in the other room. We're going to do a little bit of table talk, some idea exchange, some brainstorming, some question answering and asking, and get some ideas generated and going. And then we'll come back into this room, okay? So enjoy for lunch, and we'll group you back up again in just a little bit. I do have one request though. If Steve and Angie and a representative from each of the GROW 2 grants would come down here real quickly. We want to get a great picture because we're going to push you out on social media today. So, and Tim is fortunate. So just a quick photo. So smile pretty for us if you would. You guys want to? Yeah.